Hello, everyone. My name is Raj Reddy, and I was one of the Capella Fellows this past year, and my capstone is on advancing our access to care agenda. A little bit about me. I'm originally from a border town in South Texas, where my early exposure to a federally qualified health center showed me what healthcare should be like in this country. I'm now a rising M4 at Baylor College of Medicine in Houston, and I hope to apply into neurology this fall. I'm also currently completing an MS in health policy at the London School of Economics, where I focus on comparative health system design, pharmaceutical economics regulation, and cost effectiveness analysis. I'm also currently the vice chair of DFA's Access to Affordable Care Impact Area, as well as a member of the DFA FDA Advisory Task Force. So those two areas are also my areas of focus for my fellowship. I chose to use this capstone to reflect on my development and maturity as an advocate over the past year. I've been involved in advocacy for several years before DFA, but I always felt pressure to be all the different types of an advocate. These are definitely not exhaustive, but the four major categories that I think of are being a PR strategist, who is somebody who is really good at social media, which is definitely not me, a protester who's a really good community organizer and often is working outside of the system, a writer who is often a researcher or is writing original pieces of their own thought commentary, and a negotiator who is somebody who really values a collective voice, is often synthesizing what the other three categories of advocates come up with and working within a system to influence change. While obviously all four are really important and they overlap in various ways, I think I've found and become much more comfortable with the idea that the fourth often fits me the best. I think I was trying to pigeonhole myself into the other three categories a lot more often previously, but now I've come into my own and realized that it's okay to be in this kind of fourth category that I've made for myself, and learn to collaborate with other people who are in those other categories and elevate their voices. The other thing I've become really much more comfortable with this year is learning that advocacy is nonlinear and we have to be adaptive. I think this year I was really thinking that I would have a very specific advocacy focus throughout the year. And of course, other issues come up throughout the year. There's pending bills or rules or lawsuits going through the courts, and we have to be adaptive and reallocate our time effectively if we want to be engaging in time-sensitive advocacy. So that's another thing that I think I learned from this year. A little bit about my year in advocacy. This is one example where I testified to the Centers for Medicare and Medicaid Services on the importance of Medicare drug price negotiation, specifically for two drugs, Eliquis and Xarelto, which are blood thinners often used for patients with stroke and atrial fibrillation. Again, since I'm going to neurology, hopefully that was a big interest of mine as well. And it was a great opportunity, I think, to have that direct interface with CMS as well. I also participated in the FDA fly-in in March, and one of my major priorities was focusing on reducing the need for biosimilar interchangeability as designations. It's kind of an intricate topic, but basically relates to reducing patent exclusivity for really expensive biologic medications. I also wrote the DFA statement on Mississippi Medicaid expansion, initiated the DFA statement on the new Texas immigration law, and also assisted with the drafting of a agreed declaration alongside various other activities that I was involved in as part of my capacity as the vice chair of the AAC impact area. And yet another thing that I became comfortable with this year was realizing that there's often a lot of ongoing incremental work and things are not necessarily going to happen in one year. I think I was hoping that a lot of the projects that I had started this past year would be complete by the end, but that was, of course, not a realistic idea from the outset. But again, all these issues ended up coming up throughout the year. And so I felt like I had to take advantage of those opportunities and start things even if I knew they wouldn't be complete. I think I've been really lucky to form a really strong medical student advocacy network through my various organizations that I've been involved in. And all of those students have their own footholds in other organizations or other efforts that they're working on. So it's also a really great way to learn how to be an effective collaborator and follower and not feel like I necessarily had to be the one leading every single effort all the time, because that would, of course, be unsustainable and impossible with all these different issues. But this is a number of the various areas that I've been kind of working with and working on incrementally over this past year with other teams of students. And of course, like I said, there's other issues that come up. So even though I thought I was going to be focusing a lot of my advocacy on the access to care and pharmaceutical regulation space, other issues came up that I felt like I was really passionate about and needed to comment on. And I think it's important to realize that our advocacy doesn't necessarily have to have silos either. So other issues that came up this year were cannabis descheduling and drug decriminalization, medical aid in dying and opposition to death penalty, and of course, calling for a ceasefire in Palestine and opposing U.S. funding of war crimes. So I think I think a lot of this year is coming more comfortable with my advocacy identity and what I want to focus my energy on, and not trying to necessarily fit a picture of what of what I thought advocacy should be or what I thought other people's expectations of my advocacy would be. So I feel like this is a really, a really important year for me in my development as an advocate. And I hope that was a nice summary of what I've been working on this year. Thank you all.